Hello viewers. Today we are going to discuss about wound assessment. So the objective of this video is, at the end of this video, viewers will be able to tell the meaning of wound healing, explain the importance and frequency of accurate wound assessments, discuss the common characteristics of patients to be assessed, and understand how to assess common wound characteristics. Let me go into the discussion of this topic. Accurate wound assessment is a critical component of effective wound management, which often drives topical therapy and signals progress or problems in the healing process. Although accurate wound status assessment may sound simple, it is in fact complex phenomena. Wound assessment is essential in informing the selection of appropriate therapeutic strategies to achieve clinical goals like the stage of wound healing and how far the patient is improved in his health status. So let us see the meaning of wound healing or wound assessment. Wound assessment is a systematic process of assigning numbers or grades to the wound or wound characteristics during an examination. It is about assessing the wound and wound bed, planning appropriate interventions, and evaluating those interventions in continual assessment and reassessment. Accurate and timely wound assessment underpins effective clinical decision making, enabling appropriate goals to be set for the management of the wound in order to reduce morbidity and cost. Coming into the general assessment that has to be made before going into the specific wound assessment. The general assessment is to identify and eliminate any underlying causes or contributing factors which may impede the wound healing process. A holistic assessment aims to gain an overview of the patient's medical condition, the cause, duration, and status of the wound, together with any factors that may impede healing, including age of the patient, since the speed of wound healing or the accuracy of healing vary between the younger age group and the patients with extremes of age. Next is the comorbidities like diabetes, cardiovascular disease, respiratory disease, venous or arterial disease, or presence of any morbidity which may delay or hinder the wound healing process. Certain medications the patient is taking also interfere with the wound healing, and obesity and nutritional status has a greater role in the wound healing process, in which the last video of mine on the topic wound healing, we have discussed in detail about it. Impaired blood supply to the part of the body where the wound is present, are the lifestyle factors like smoking, alcohol, sedentary lifestyle, reduced oxygenation or tissue perfusion to the site of the body, systemic or local infections like osteomyelitis, all this will affect the wound healing. In addition to this, it is also important to understand how the wound is affecting patient daily living. Example, if the patient is having the pain with the wound, which may affect the patient's sleep or their activities, and the presence of odor, the pain produced during the dressing change, all this will affect the patient's activities of daily living. So assessment of these general factors will enable the healthcare professionals to design the treatment modalities for the wound healing. Next, we'll see how frequently we need to assess the wound. The frequency of assessment will depend on the patient healthcare setting in certain aspect. In acute care patients, we may have to assess the wound healing daily or each time we change the dressing. In long-term care facilities, on admission or bi-weekly or weekly thereafter. In case of home care setting, during the home visit, the wound may be assessed. Regardless of this setting, the frequency of reassessment should be based on the wound characteristics observed at the previous dressing change or according to the healthcare provider's orders. Next, we'll see in general, a wound should be reassessed after the patient returns from the operating room if the wound noticeably irreversibly deteriorates, if the wound develops an odor or purulent exudate, if any other significant change in the condition of the wound has been observed after patient has returned from another facility. In all the settings or situations, we may have to assess the wound according to the condition of the wound. Next, we'll see the importance of wound assessment. Wound assessment can be defined as information obtained using observation, questioning, physical examination, and clinical investigations in order to formulate a management plan. The peri-wound area should be included in any assessment. Peri-wound area has previously been defined as the area of skin extending up to 4 centimeters beyond the wound edge. For some wounds, damage may extend outward, whereby any skin under the dressing may be at risk of breakdown and should be included in any assessment. So the peri-wound area has to be included during assessment. The factors to be observed are maceration, excoriation, dry or fragile skin, hyperkeratosis, callus, and eczema. It can also provide a baseline from which to monitor the wound, the effectiveness of therapeutic strategies over time, and impact on patient well-being. Next, we'll discuss about the assessment components. Assessment components can be observed based on the wound healing. Either the wound is healing by the primary intention or secondary intention. To understand this, you can watch my previous video on the wound healing. If the wound is healing by primary intention, then we need to assess the approximation or epithelialization of the wound margins, which may start from during the third postoperative day, or the drainage. Usually, a closed incision should not have any drainage, evidence of infection, presence of palpable healing ridge along the incision, which may be seen up to the 5th postoperative day. This palpable healing ridges may not be palpable if the patient is more than 2 or 3 weeks postoperative. In this case, the wound is considered to be fully granulating, that is, healing normally, if it is well approximated and has no signs of drainage or infection. Factors to include in a comprehensive assessment different for the wound healing, which are healing by the primary intention and the secondary intention. Next, we'll see the factors which to be observed if the wound is healing by the secondary intention, which may include location, dimension and depth of the wound, dimension and depth of tunneling and undermining. We will be discussing this measurement of tunneling or undermining in my next video. Stages of wound healing, appearance of wound base, status of wound edges, which may differ with the closed or the open wound. Evidence of heavy bioburden, status of surrounding tissue like edema, cellulitis, maceration, and breakdown. Appearance of wound base may be the granulating or epithelializing, which may differ with the clean non-granulating, or the wound is slough or formed with the eschar. Next, we'll see elements of the wound assessment, which are very, very important. Based on these elements, the wound has to be assessed and the treatment modalities need to be devised. The wound assessment factors or the characteristics are divided into series 1, which I'm going to discuss in this video. The factors of series 2 will be discussed in my next video. In this video, I'm going to discuss about the location of the wound, age of wound, type of wound, tissue involvement, moisture, infection, and wound edges. Let us move into these factors. The first factor is the location, which means where the wound occurs on the person's anatomy. Here, you may use the anatomical terms like iliac crest or hip, something like that. Or you can use the descriptors like lateral, medial, proximal, distal. With that, you can use. If the wound is multiple, then you can identify the wound with the letters such as A, B, C. And the measurement can be taken on any wound as a single wound measurement. Location may help to determine the etiology of the wound. Sometimes the wound will be determined based on the etiology. Some of these examples are venous ulcers, which may be commonly seen above ankle, medial lower leg. Arterial ulcers seen over leg, lower leg dorsum, foot, lateral border of foot, toe joints, and malleolus. Whereas neuropathic ulcers are seen and the plantar surface of foot and heel, metatarsal heads, lateral border of foot, and mid-foot deformities. So this is the location we need to consider. So viewers has to remember to locate the wound using the anatomical positions. If there are more than one wound is there, then you can refer the wound with the certain numbers or the letters like A, B, C, but measure the wound as the single wound. Then based on the etiology also, we can identify or locate the wound. Based on this, let me have your pictures to show you some of the anatomical sites. Viewers, can you identify which is the wound site, all these areas? Hope you are able to identify the anatomical location of these wounds. So the first wound is referred as the coccyx wound. Second one is right forehead wound, mid-abdominal incision, dorsum of the left hand, left medial malleolus, right below knee, amputation stump. So you can use the anatomical term right, left, above, below, lateral, medial, all this to refer the wound. Hope you are clear with the location of the wound. Next, we will see into the age of wound. The second characteristic what the assessment has to be made is the age of the wound, which usually be described in terms of days, weeks, months, or the years. The age of the wound will help you to determine whether the wound is the acute wound, which may be less than 4 weeks old, whereas the chronic wound which will be lasting more than 4 weeks. Age of the wound will help to guide treatment and will help to inform you the healability of the wound. The third characteristic. So here we need to know the etiology or the cause of wound, like surgical wound, pressure ulcer, trauma, something like that, are based on the morbidity condition, diabetic foot ulcer, surgical wound, peripheral arterial diseases. Miscellaneous atypical wounds, which may include skin cancer, burn, trauma, pressure ulcer, and venous ulcer. Common type of are pressure wound, venous or arterial neuropathic, and diabetic foot ulcers, are surgical wound or trauma wound. The fourth factor is the extent of tissue involvement, based on the depth or how far the wound is involved in the skin surfaces. We can divide the wound into 4 stages. Stage 1 includes superficial wound, which involves only the epidermal layer of the wound, whereas stage 2 wounds are partial thickness wounds, which may affect the epidermis and may extend into the dermis. Stage 3 wounds are full thickness wounds, which extend through the dermis and into the adipose tissues. Stage 4, full thickness extends through the dermis, adipose tissue, and which may expose the muscle or the bone. From this picture, you'll be able to identify the extent of tissue involvement in wound. The fifth factor what need to be assessed is the moisture. Presence of moisture will enhance the autolytic process and act as a transparent medium for essential growth factors during epithelialization. The choice of wound dressing also will be based on the moisture level, because the high levels of exudate is important for wound healing. In addition, dressing aim to minimize maceration and leakage as well as reducing odor. If the wound becomes too dry, this will slow epithelial migration. Whereas if the wound is too wet, the exudate may damage the periwound skin and cause maceration, which can be assessed using the subepidermal moisture scanner. It is mainly used to assess the risk of developing pressure ulcers. This subepidermal moisture scanner comprises an integrated sensor which is applied to the skin with sufficient pressure to measure changes in the dielectric constant of the material, detecting the sensor. This change in subepidermal electrical capacitance reading at an anatomical site can help to predict the risk for developing the pressure ulcer. The subepidermal moisture scanner will be discussed in detail when I am discussing about the diagnostic modalities used in assessing the wound. Whereas the moisture, maintaining the adequate moisture is very, very important in wound healing. The wound should not be too dry and it should not be too wet. It should be maintained the optimum moisture. The next characteristics what we are going to discuss about is the infection. Note the presence or absence of signs of symptoms of local infection during the wound assessment, which may include erythema, pain, edema, purulent exudate, and wound odor. Keep in mind that patients with chronic wounds may not exhibit these classic signs and symptoms of infection due to the presence of biofilm, that the layer of pathogens which may present over the wound. Symptoms of infection due to the presence of biofilm may vary, which may mask in case of the chronic wounds. These biofilms are the extracellular polysaccharide matrix which embeds microorganisms, which delays healing and renders infection difficult to diagnose. The seventh characteristics need to be assessed is the wound edges. The wound edges are classified into 5 different types of edges. The first one is the indistinct or diffuse wound edge, which is unable to distinguish wound outline clearly. So here you cannot see the outline of the wound very clearly because the normal tissue have blended into the wound bed. This type of wound border or edges are known as the diffuse or indistinct wound edges. The next wound edge is the attached wound, even or flush with the wound base, which shows no side walls present, where the wound edge as well as the normal skin are flat, which may not distinguish the wound edges or the wound borders. The third type of wound edge is the unattached wound edge, where the side or walls are present. Floor or base of the wound is deeper than the edge of the wound, which very clearly shows the border of the wound. The fourth type of wound border or edge is the rolled under or thickened borders. Here you can see how the wound borders are very thick, which are very soft or firm, which may be flexible to touch. The next type of wound edge is the hyperkeratosis, where the wound borders forms a callus-like tissue around the wound at the edge of the wound, which distinguishes the wound healing, and also these callus-like borders will affect the wound healing process. So this is the just for you to identify the wound edges. Can you identify what type of wound edges are these 4? Yeah, just to see, the first is the attached wound edge. Okay, we can see even or there is a wound edges even are flushed with the wound base. There is no side walls present. Whereas the second type of wound edge is the unattached wound, where the side walls are present, but the wound is little deeper than the side walls. Here, this is the hyperkeratosis wound, where we can see the callus formed over the wound. Wound is also deeper. The last picture shows the indistinct wound borders, which means we are not able to identify the wound border as well as the wound. This type of wound borders are known as the indistinct wound borders. Hope you are able to understand the wound edges. Yeah. So in wound assessment, it is very, very important to wait, watch, and act, because we need to wait the wound healing and watch the wound healing. Constant watch over the wound will help to plan our therapeutic interventions appropriately and manage the wound. So wait, watch, and act is important in the reassessment of the wound. So the photographs and illustrations are obtained via the Google Images, where I mentioned are not, the images all taken from the Google. These are some of the references I have made in preparing the content of this wound assessment. So see you all with my second part of the wound assessment, with all other factors like size of wound bed status, necrotic tissue, wound exudate, peri-wound area, odor, and pain of the wound will be discussed in my next video. Thank you, viewers. Have a nice time.